Welcome back. In this video, I will be discussing the MCQs on opioid analgesics and antagonists and drugs of abuse. Question number 1. Morphine produces analgesia by acting at A. Peripheral pain receptors, B. A spinal site, C. Supraspinal site, and D is both spinal and supraspinal site. The answer is D. Opioids produce their actions at a cellular level by activating opioid receptors. These receptors are distributed throughout the CNS with high concentration in cerebral cortex, periaqueductal gray area, thalamus, and substantia gelatinosa of the spinal cord. Next, instead of depressing, morphine stimulates A. Vasomotor center, B. Edinger-Westphal nucleus, C. Temperature regulating center, and D is cuff center. The answer is B. Morphine is a pain medication of the opioid family. Opioid analgesics have pharmacological effects in many organ systems, including the eye. It stimulates the Edinger-Westphal nucleus of the optic pathway and causes the constriction of the pupils. Next, the antidote of choice for morphine poisoning is A. Nalorphine, B. Nalbuphine, C. Naltrexone, and D is naloxone. The answer is D. Naloxone is a medication used to block the effects of opioids. It is used for the complete or partial reversal of opioids overdose, including the respiratory depression. So the antidote of choice for morphine is naloxone. Next. Morphine is contraindicated in head injury because A. It does not relieve the pain of head injury, B. It can raise intracranial pressure, C. It can cause constipation, and D is it is liable to cause addiction. And the answer is B. In humans with severe CNS trauma or head injury, an inflammatory response commonly occurs in the brain. This damages the blood-brain barrier, and hence the morphine metabolite, which is a CNS irritant, can enter the brain in increased amounts and raises the intracranial pressure, and it can lead to further damage. Next, which of the following opioids is the best choice for treating the pain associated with diabetic peripheral neuropathy? A. Morphine, B. Tapentadol, C. Codeine, and D is buprenorphine. And the answer is B. Tapentadol has a dual mechanism of action. It is a mu agonist and norepinephrine reuptake inhibitor that has demonstrated effectiveness in treating the neuropathic pain. Morphine and buprenorphine would decrease some of the pain associated with neuropathic pain, but are not the best choices. Next, a 70-year-old female with renal insufficiency presents to clinic with severe pain secondary to a compression fracture in the lumbar spine. She reports that the pain has been uncontrolled with tramadol. Which of the following is the best opioid for this patient? A. Meperidine, B. Fentanyl, C. Hydrocodone, and D is morphine. The answer is C. Hydrocodone would be the best choice of the opioid given in this case. It will be very important to use a low dose and monitor closely for proper pain control and any side effects. Next, a young woman is brought to the emergency room. She is unconscious, has pupillary constriction, and depressed respiration. On investigation, an opioid overdose is almost certain. Which of the following opioids will exhibit an immediate response to the treatment with naloxone? A. Meperidine, B. Morphine, C. Buprenorphine, and D is fentanyl. The answer is D. Morphine overdose can be effectively treated with naloxone, and morphine is phenylephrine. Naloxone antagonizes the opioids by displacing it from the receptor site. Next. Opioid analgesia is preferred over aspirin-like analgesia in the following condition. A. Acute gout. B. Burn. C. Toothache. And D is neuralgia. And the answer is B. Management of acute pain is essential in the treatment of burn patients. Opioids are commonly used for burn analgesia. They are effective and used in the clinical management of acute and procedural pain following severe burn. Next. Which of the following is an agonist-antagonist type of opioid analgesic? A. Pethidine. B. Pentazocine. C. Fentanyl. And D is buprenorphine. The answer is B. Pentazocine is an opioid analgesic used to treat moderate to severe pain. It works by activating the kappa opioid receptors and blocking the mu opioid receptors. So it is an agonist-antagonist type of opioid analgesic. Next. Genetic polymorphisms in certain hepatic enzymes involved in drug metabolism are established to be responsible for variations in analgesia response to A. Codeine, B. Fentanyl, C. Meperidine, and D is tramadol. And the answer is A. Codeine, hydrocodone are metabolized by the cytochrome P450 isoform, and variation in analgesia response to these drugs have been attributed to genetic polymorphism in this isozyme. In the case of codeine, this may be important since the drug is demethylated to its active metabolite by cytochrome P450 isozyme. Last but not the least, drugs of abuse. Question number 1 is, which drug is used in smoking cessation programs and increases the perception of colors? A. Buprenorphine. B. Nalbuphine. C. Acamprosate. And D is varenicline. And the answer is D. Varenicline occludes the rewarding effects of nicotine and is used in smoking cessation programs. The drug also heightens the awareness of colors. Next. A young male has been brought to the emergency department of a hospital suffering from an overdose of codeine after its intravenous administration. The symptoms are not likely to include A. Agitation, B. Bradycardia, C. Hyperthermia, and D. Seizures. The answer is B. Overdoses with amphetamines or cocaine have many signs and symptoms in common. However, the ability of cocaine to block the reuptake of norepinephrine at sympathetic nerve terminals results in greater cardiotoxicity. Tachycardia is the rule with possibility of arrhythmias or stroke. So the symptom not likely is bradycardia. Next. Psychological dependence is A. Decreased responsiveness to a drug following repeated exposure. B. A combination of certain drug-specific symptoms that occur on sudden discontinuation of a drug. C. Compulsive drug-seeking behavior. And D is all of the above. The answer is C. Psychological dependence is basically marked by a persistent, strong urge to use drugs despite negative consequences. So it is a compulsive drug-seeking behavior, while the physiological dependence is marked by the withdrawal symptoms that make you feel physically ill. Next. In contrast to morphine, heroin is A. Used clinically, B. More addictive and fast-acting, C. More effective orally, and D is less potent and long-lasting. The answer is B. Morphine is a naturally occurring substance derived from the opium plant. whereas heroin is a processed form of morphine and it is more addictive and fast acting than morphine. Next. The following drug of abuse is a hallucinogen. A. Cocaine, B. Cannabis, C. Heroin, and D is methadone. The answer is B. Hallucinogens are the drugs that alters your perception of reality by changing the way the nerve cells in your brain communicate with each other. Examples include cannabinoids, they are the lysergic acid, diethylamide, and so on. Next. Cocaine exerts its central action by A. Inhibiting phosphodiesterase, B. Increasing release of catecholinergic neurotransmitters, C. Inhibiting dopamine and norepinephrine reuptake, and D is altering serotonin turnover. The answer is C. Drugs of abuse can alter the normal communication processes in brain. Cocaine acts by binding to the dopamine transporter, blocking the removal of dopamine from the synapse. Dopamine then accumulates in the synapse to produce an amplified signal causing euphoria. Next. Which of the following sedative hypnotic agent has the highest abuse potential? A. Risperidone, B. Diazepam, C. Phenobarbital, and D is zolpidem. The answer is C. Barbiturates were once the primary medications used in the treatment of anxiety disorders. However, they are also significant drugs of abuse. Phenobarbital is used in lethal injections as it shuts down the action of the central nervous system that control the breathing and heart rate when used in higher doses. Next. A 21-year-old college student is curious about the effects of LSD, that is lysergic acid diethylamide. She asks what type of risks may be involved with using the drug for the first time. Which of the following is the side effect of LSD? A. Exaggerated hallucinations, B. Cardiomyopathy, C. Hyperphagia, and D is bronchitis. And the answer is A. Exaggerated hallucinations, sometimes known as bad trips, may occur even in first-time users. These hallucinations can lead to extreme panic, which has caused individuals to react in a manner very uncharacteristic of their typical behavior. Next. Which of the following is the common adverse effect of amphetamines? A. Bradycardia, B. Somnolence, C. Constipation, and D is hypertension. And the answer is D. Hypertension is a possible adverse effect that warrants caution, especially in individuals with risk factors for increased blood pressure. Amphetamines cause tachycardia, insomnia, diarrhea, and alertness. Next. The following CNS stimulant occurs naturally and can be found in certain candies. A. Amphetamine, B. Clonidine, C. Modafinil, and D is caffeine. The answer is D. Caffeine is a naturally occurring substance found in cocoa, chocolate, and many forms of tea. Overuse of cola beverages and other caffeine-containing products may cause adverse effects including anxiety and insomnia, and even increase the risk of seizures. Thank you.